if you could give us an update, I'd appreciate it.
Okay, thank you, Mayor, Council. So to your point, things have changed in the last 5 days. And in fact, Maricopa Public Health held a press conference yesterday and said that 27% of all COVID-19 cases in Maricopa County have occurred in the last 7 days. And so we've seen a dramatic spike in our numbers. I know at the national level, we have stabilized and we've had weeks. I look at the weekly averages where we've seen the averages come down. But from the state perspective, the county perspective, and really all counties within the state of Arizona, the city of Chandler, and then our zip codes, each one, we have seen increases, especially within the last 2 weeks. 2 weeks ago, we saw our first weekly increase of 30%, and we're on track right now for about 27% for this week. There's a lot of information out there, and there's a lot of people that think that the increases are due to the testing. So we did look at the testing. I had my staff put something together. The week of the 10th of May, we had 45,249 PCR tests, and we had a positive rate of 5%. That was our high water mark for PCR tests in 1 week. I can tell you that the week of May 24th, we had 42,649 PCR tests, and we went up to 9%. Last week, we had 43,764 PCR tests, and we were at 12%. And right now, we're tracking at 13%. And so we have increased testing. The Blitz testing that started back in May has been extended. However, we've seen a relatively stable amount of test numbers, but our percentages are going up. The last 6 weeks was 5%, 5%, 6%, 9%, 12%, and like I said, right now we are currently tracking at 13%. Specifically to Chandler, as I said, and I know that you guys have been briefed on this before, 85224 was our zip code where we were seeing the most cases. Currently, as of this morning at 9 a.m., we have 254 cases in 224. 225 has really been our most rapidly growing zip code. It's now at 304 this morning, and then the rest of them have been relatively stable. But across the board, and it's been all over the news, obviously at the national news, and then here locally, we have seen a pretty dramatic increase in our numbers over the last 2 weeks.
Got a question? I just want.
Before I open this.
Well, I just wanted to. Thank you. I kind of wanted to discuss this a little bit more as it relates to the opening and closing of the city, right? So we're seeing numbers track up, we're seeing the percentages track up. And so if anybody's been paying attention, I've been worried about being closed for a very long time for mental health reasons, for alcohol abuse, car theft, all the things that were going on that was sort of behind the scenes that nobody was talking about. That was a big concern for me. So I wanted hopefully to find this, as Councilmember McClyman said, this balance of let's get back to work and let's be safe, right? And so what we did was we flicked the lights back on. Everybody started going back to work. They're going to restaurants. They're demonstrating, protest. Everything has happened, and now we are seeing a spike in the number of cases. We're seeing community spread. So what does that mean? I don't know what that means for the rest of the state, but I know that it's an important discussion for us to have here in the city. And so I want everybody to know that while I was clamoring to get open for those same reasons, I could be clamoring to get closed for the exact same reasons, because I think when we sit up here and we just talked about public safety in our police department, we also have a duty to be as responsible as we can on this dais. And so that's why I asked the questions, to kind of give you a little bit of background. So what does that mean? I may have more questions, but I'll let Councilmember Orlando.
Let me ask one first. Thank you.
Thank you.
Chief, what are you hearing from our hospitals in the midst of this? That's always been kind of a monitor. I know we've been hearing things from Banner in particular on the news, but not so much from Chandler Regional or Mercy Gilbert. What are you hearing, sir?
Mayor, that's a great question, and we've always been focused on our healthcare infrastructure, which is why we tried to flatten the curve. I did have conversations today with all three hospitals. I can tell you that Chandler Regional, they do a census count every night at midnight. Last night, they did a census count of their licensed beds within the hospital, and they were at full capacity. They had 18% capacity within their ICU. Gilbert had about 5% capacity left in their licensed beds within the hospital and 33% capacity in their ICU. And then Banner Desert had 15% overall on their floors, licensed beds, and they have 25% capacity in their ICU. Now they run their ICU a little bit differently in that they split it up into a ICU for COVID and a non-COVID ICU. So within their COVID ICU, they have about 25%. I think it's extremely important to know that although they are at capacity or they have very little capacity left, that this is the normal operations that these hospitals run at. I talked to the CEO from East Dignity East Valley, and this was always, these are the numbers that they see this time of year. Specifically, I asked, are these COVID-19 numbers that you're seeing in the hospital? He said, no, these are, they certainly have COVID-19, but these are just very sick people. They've just had a run of patients that are extremely ill right now. Now, obviously, that's still going to have an impact on our healthcare infrastructure because we are seeing the COVID-19 numbers raise. But right now, they were very comfortable. I asked them if they were going to enact their emergency operations, if Chandler was going to put their tent back up, or Gilbert. They were content where they were right now. They do have procedures in-house where they can create more bed space if they need to, and they were not doing any of that at this moment.
And is there, I know there was early conversation about reinstating St. Luke's and some other things. I missed much of the governor's call today, kind of came in on the Q&A, but is that conversation being enacted yet?
That conversation is taking place, and they are actually trying to narrow it down from a couple of weeks to ramp that up to a couple of days so that when they can make that notification that things start going in motion and they can get that hospital up.
Okay, thank you. Sorry, Councilmember Orlando.
You addressed my questions, Mayor. Thank you for the hospital issue. Thank you.
Okay. Councilmember Rowe.
Thank you, Mayor.
I didn't know if you want to just continue on is what you're saying. I apologize. I was just asking a question. Are we going to talk about the other issue now or what?
We will, yeah.
Okay.
But go ahead, Councilmember Rowe.
So, Chief, this could be a fairly complex discussion, and it is more than just cases. It's how many of those people end up in critical condition, how many of those people end up actually dying, how much better are treatments than they were when this began in March, or before March, in fact. There's an awful lot of different things at play here. There's hospitals trying to stay in business because, face it, they have rooms, and they have rooms for a reason, and that is to treat sick people. And so they like to keep the rooms full. Not that they want people to be sick, but that's just part of their business model. So am I right here at all? Am I on some of this, Chief? You want to comment on that?
Councilmember Rowe, this is a very complex subject, and there's a lot of variables in there. But I would agree with you. Everything from treatment modalities to vulnerable populations, there's just so many aspects to this conversation as far as where we're at as a community. I know I did have an opportunity to listen to the governor's press conference today, and Dr. Kara Christ, who is the medical director for AZDHS, did say that right now we have sustainable widespread, but that's going to continue, and they don't see that stopping. So it's a matter of how we figure out how we're just going to live with this. And I think that's probably the biggest question is, where is that comfort level where we know that it's out there, but we're going to continue to do what.
Okay, well, thank you, because, I mean, do we know how many cases actually, so you've got contracted people that have it, and then how many of those people actually become critically ill? And if they have it, are they even showing any signs? I mean, there's that whole range there. No signs at all, then some sick a little bit, critically sick, and death. I mean, it's a serious thing, and I wouldn't discount any of it, but it's complex too.
Any other questions for Chief Chief Dwiggins? That's what I said, Dwiggins, so, for the record. Councilmember McClymonds.
Thank you, Mayor. In the last week, 27% of all cases have occurred in the last week, correct?
That's correct.
Now, in the hospital, the news is, we're nearing capacity, just like you alluded to. Now, the COVID part of that, have you seen that same percentage jump at that magnitude?
Mayor, Councilmember, we have seen an increase. I don't know if it's exactly tied to that. As I said, there are still sick people out there with cardiac arrest or cardiac issues, strokes, things like that. There was actually discussion that people were for a while scared to go to the hospital because they thought they could be infected by this virus, so they stayed home, which obviously exacerbates any type of underlying medical condition. Now these people are showing up and they're very sick, and so they're being admitted to the floors or potentially the ICUs. There is a graph out there that the governor uses where they show the percentage of COVID-19 cases within the hospital versus the percentage of non-COVID-19 in the hospital. And of course, the non-COVID-19 is really what the majority of those cases are that they're seeing.